Welcome, everyone. Luke Timmerman is the founder and editor of the Timmerman Report, an award-winning biotech industry newsletter. He's also an author and an anti-cancer activist who's raised more than $2.4 million for research through his Climb to Fight Cancer campaigns. One focus of biopharma sustainability is on our social impact through new medicines and through improved access to healthcare. This last pandemic year has put a spotlight on our sector, both from the spectacular R&D efforts that brought us the new vaccines to the ongoing and complicated rollout to make them accessible globally. Luke will share his perspective on the ongoing need for global cooperation to improve our capacity to respond more effectively to future pandemics.
Hi, everyone. I'm Luke Timmerman, the founder and editor of Timmerman Report, a biotech industry newsletter. And it's a real pleasure to be here today at the Biopharma CEO Forum and share a story that I think many of you will find interesting and forward-looking. Today, I want to talk about the need for global cooperation on virus surveillance and vaccination. And these two things really go hand in hand. We are in an age of pandemics. This is a phrase that was coined last summer. Here's an excellent paper in the journal Cell by David Morens and Tony Fauci at the NIH, where they talk about some of the mega trends at work, which are population growth, urbanization, rise of industrial agriculture, global economy, people traveling all around the world much more than they used to. These are all kind of key ingredients in kind of laying out the tinder, so to speak, for future pandemics. So this is something that we all really, especially now as we're coming out of the situation, really want to think about long-term, how we can better prepare. And this is just one example of one of those mega trends I was pointing to. The number of visitors to the US from China has really changed a lot in the period between SARS-1 and SARS-2. As you can see, there just wasn't a whole lot of travel from one country to the other, and now there is. And we can think of this as a proxy for many other countries in a globally connected world. And to borrow a phrase from Ben Franklin, an ounce of prevention is worth a pound of cure. In this case, the estimates are the economic impact of this pandemic was something like $16 trillion. So if we need any more incentive to make some investments today, it's hard to imagine what that might take. There's an urgency. Now, the good news is that we have some amazing infrastructure and tools that were already in place. And so I'm based in Seattle, and I'm well aware of this group, this open resource called NextStrain, which is run by the Fred Hutchinson Cancer Research Center and the University of Basel. It's supported by the Gates Foundation, Wellcome Trust, among others. And they were established, they won an open science competition a few years ago to do real-time genomic epidemiology. And they started with flu. There was something called the Seattle Flu Study that was up and running in my community, where researchers were tracking the variants of flu, how it moves through a community, how variants develop. And so everything from genotype through phenotype was being captured. A research team here in Seattle, when a person came down with a positive diagnosis of flu, their samples were sent for genome sequencing. They were uploaded into an international database called GISAID, so everybody around the world could see this. Now, of course, when the pandemic hit, this group turned on a dime. They're scientists. They wanted to think about how this infrastructure could be pivoted into helping us better understand what we were dealing with here. And some of you may remember Trevor Bedford became something of a social media star when he was the first to declare on February 29th that there was community spread in the United States, here in the state of Washington. There was more than just the one case from the Kirkland nursing home that people saw on the news, but there were other cases that were genetically distinct. So there was clear evidence that we had an outbreak here. And at that time, the CDC really wasn't saying very much. So, but the point is here that we have a model that can provide sentinel warnings. That's the good news. Bad news is that they are not being adequately utilized. So I mentioned Trevor Bedford. By about December, you'll see on this timestamp, the United States was still kind of trickling along in terms of the number of samples that were being processed for genomic surveillance. Whereas the UK, country with similar kind of capabilities in terms of genome sequencing centers, had really ramped things up in terms of the number of samples. These are people who were clinically diagnosed as positive with coronavirus, and then having those sent in to the lab for a genomic analysis. Most benchmarks would say that we need about 5% of samples to be sequenced to provide us that kind of granular information, and the United States just hasn't gotten anywhere near that, even still. And somewhat frustratingly, one of the postdoctoral researchers here in Seattle, Pavitra, was pointing to some of the reasons why we're apparently not doing this. And it's cost, it's reagent shortages, it's staffing, space. I mean, these are all solvable problems. So it's been somewhat frustrating that we have this capability and we're just not fully utilizing it. Of course, now there are efforts on the federal level to try to play catch up. Some of you saw the news about the CDC putting a $200 million down payment in to beef up this genomic surveillance capability around the US. And it coincides at a time when we have seen a lot in the news about these variants, the B117, the B1351, sometimes known as the UK and the South Africa or the Brazil variants. They're here. They were first detected in those other places, partly thanks to the genomic surveillance that they have. But it just makes the point that this is an interconnected world. It's a pandemic. These sequences, these variants are going to get around, and they have. Now, but we do have this incredible capability with mRNA vaccines. And I bring up this is one of the stories from my own archive. You'll notice the date line on this, October of 2013. Moderna, a company that few people had heard of at that time, had secured a $25 million grant from DARPA. And what did DARPA like about this messenger RNA technology? They saw it as something that could be made cheap, super fast, and an unusually adaptable method for fighting future pandemics. Now, at that time, they were thinking more about a 1918 type flu situation for national security. Nobody was really talking about a SARS-2. But the point was that you could, as Moderna has said, this is like digital information. When you've got the sequence to a new novel virus, it can be used as the template for a very tailored, potent vaccine. And this can be done extremely quickly, within about 2 months, actually, from sequence to first in human experimental vaccine dosing. So there are people in the government who have been looking ahead to this kind of moment, and a lot of groundwork has been laid. And now, of course, we're seeing it in action. Moderna has very nimbly, as has Pfizer and BioNTech, sought to adapt their vaccines. This question of will the vaccines remain effective against the variants has been a burning question for several months now. And so far, the answer has been very encouraging against all the variants to one degree or another. But Moderna still and BioNTech, they still have these multivalent vaccines or booster formulations that are now in the works that can be formulated very quickly based on that genomic surveillance information, tested in people very quickly, and turned into more broad coverage against a variety of variants, more effective vaccines. Now, how do these things go together? In order to really have a nice hand in glove situation, between the genomic information about the virus itself and the vaccines, you need a number of listening centers, so to speak, or sentinel nodes that can sound those warnings. And here was an announcement from BioNTech recently in which they are establishing this very interesting facility in Singapore. So Singapore has a lot of things going for it with a science and technology infrastructure that's been building for 20 plus years. They have a trained workforce. They have the 7th busiest airport in the world. And a lot of tourists coming through there or connecting through there from all around Asia Pacific and around the world. So you have the possibility here to capture, if someone is sick on a flight or presents with illness, a good ability to capture a sample, get a clinical diagnosis, and in BioNTech's vision here, send it down the lab for sequencing to determine what kind of variant we're dealing with. Is this an established one or something new? And if it's something new, and if it's determined that it poses some threat, there is a very real ability to go down the hall and make the mRNA vaccine constructs and scale them all the way up to about 200 million doses is the capacity that they're quoting here. And this is in a country with only 6 million people. So they could turn on a dime very, very quickly to scale up tailored vaccines at a very, at an early point in a pandemic before it really goes worldwide. And so I would expect you'll see more of these kind of regional headquarters, so to speak, investments that BioNTech, Moderna, and others are going to make around the world. Now, of course, we have an unequal world in terms of how the vaccines today are being distributed, largely to wealthy countries. But there have been 1.8 billion doses administered, about 12% of the global population, according to Bloomberg. So incredible progress has been made with the vaccines that we have, and but a lot more work needs to be done in a world with 7.7 billion people, distributing it to all the places where we need coverage. And some of you have heard about CEPI, the Coalition for Epidemic Preparedness. That's an effort, again, funded by Gates Foundation and Wellcome Trust and others to develop new vaccines. That's part of it. The push. Now, this is also the pull through. They're tackling a market failure. COVAX is this international group that has pledged to deliver, not just order, but deliver 2 billion COVID vaccine doses by the end of 2021. This is an effort on the part of wealthy countries to purchase a lot of vaccines and then distribute them to the places that have not yet gotten them, and to do it, at an incredible rate of speed. Of course, I mentioned we have a big world with 7.7 billion people connected. And as the former CDC director, Tom Frieden, points out, if there's uncontrolled spread anywhere, it's a risk everywhere, especially with the variants, because anytime the virus encounters someone who is immune compromised or unvaccinated, it can hang around and it develops it has a chance to develop new variations to escape the vaccination that we are threatening it with. So it's really in everybody's interest to flood the zone with as many vaccines as possible, as quickly as possible, and to have them provide that kind of broad coverage that we have today, and that we could expand further with more multivalent vaccines if necessary. Now, here's a piece that I read recently that just gave me a little more confidence that it can be done. This is Peter Hotez at Baylor College of Medicine. You've probably seen him on television a lot. And this is an article in the JAMA about, at the absolute height of the Cold War, the United States and the Soviet Union set aside their differences to work together on smallpox and eradicate smallpox from the face of the earth. And there were a lot of geopolitical tensions at that time, obviously, and they were able to overcome that in the name of the greater good for the world. So I take some solace that we can overcome some of our issues today to do what they did 40 plus years ago. And to close, I'll just leave you with a comment from Teddy Roosevelt that the fundamental rule of our national life, the rule that underlies all others, is that on the whole and in the long run, we shall go up or down together. I think that's those are wise words for many ways in which we think about our world, but especially with global infectious disease. Thank you very much for your time and attention today.
Okay, thank you, Luke. That was a great talk, very interesting. And everyone, please join us for our next session when we'll hear from Catalent on their long-term presentation. You should see a pop-up on your screen to join. Thank you very much.